the egregiousness of people taking themselves off of the transplant list because they could not afford to pay for elevated very expensive accommodations in Vancouver.
Hold on, they're taking themselves off the transplant list?
Yeah, absolutely.
Jude is our next caller now at Salt Spring Island. Hi, Jude.
Hi, good afternoon, Michelle. So I'm currently working with a lung transplant housing support group to actually determine the experiences and costs, out-of-pocket costs for these patients. And by far, the biggest stressor above and beyond undergoing life-saving surgery is securing housing in Vancouver.
Oh.
So organ transplant patients are required to stay proximally to Vancouver General Hospital or St. Paul's for 3 to 6 months post-transplant. They also require a full-time care provider to stay with them. So there's limited opportunities for subsidies and secured accommodations, but the need really outweighs the availability. And I think strongly we need to have the option of allowing homeowners to support, for example, travel and accommodation for patients requiring care.
Wow. Do you know what proportion of patients were using short-term rentals to be able to stay where they will be getting treatment?
Yeah, that's an excellent question. So we're just determining that. We're doing a provincial survey, but we're estimating probably a third of the patients would be relying on short-term rentals because, of course, hotels wouldn't be really suitable when you're staying 3 to 6 months and you have a care provider with you. I mean, this all came about because of the egregiousness of people taking themselves off of the transplant list because they could not afford to pay for elevated very expensive accommodations in Vancouver when they could find them. So that came to the attention.
Hold on, they're taking themselves off the transplant list?
Yeah, absolutely. Absolutely, because they need to be in Vancouver, and if you don't have a place to stay, and more importantly, if you can't afford a place to stay, you cannot go forward with your transplant.
Is there not another recourse?
No, there's not right now. Currently, we're working towards that. We believe there should be provincial funding for everybody by medical necessity who has to come to Vancouver, but currently we don't have that in place.
Oh, my goodness. Have you reached out to the Ministry of Health or the provincial government on this?
Absolutely.
Yeah. What have they said?
Well, Premier Eby was met with the BC Rural Health Network 2 weeks ago, and he's very concerned, and he's taking it under advisement, and we're trying to provide the data of exactly what people are spending, but it's upwards of $25,000 to come for transplant care in Vancouver. So he's looking at the matter right now.
Jude, thanks so much for raising this. It's certainly something that we will follow. Thank you.